Every ejaculation you've ever had is actually a health report. Yes, you heard that right. Something most men never think twice about, an everyday biological event, is actually your body sending you signals about your prostate, your hormones, and even your overall vitality. But here's the catch. Most men don't know how to interpret those signals. They shrug off changes in volume, force, or sensation without realizing their body might be whispering an early warning about dehydration, muscle weakness, infection, or even more serious conditions. Today, we're going to change that. Welcome to the Healthy Body. Dr. Alex here. Today, we're diving into 5 powerful messages your body sends you through ejaculation, and what each one reveals about your prostate, your pelvic floor, and your overall health. If you stay with me, you'll learn how to recognize the difference between harmless changes and red flags that mean it's time to see your doctor. And if you're new here, make sure you hit subscribe early on. This channel is all about practical, science-backed advice to help you live longer, healthier, and with more energy. If you care about your vitality, your intimacy, and your well-being, subscribing ensures you won't miss the strategies that can make all the difference. So, let's get started. Before we can decode the messages, let's understand where they're coming from. Many people think semen is just sperm. In reality, sperm is only about 1% of the fluid. The other 99% comes from 2 main glands. The first is the seminal vesicles. These small sacs contribute about 60 to 70% of semen volume. They add a thick, alkaline fluid rich in fructose, basically the fuel that gives sperm energy for their journey. The second is the prostate gland. This walnut-sized gland just below your bladder adds about 20 to 30% of the fluid. Its contribution is thinner, milky, and full of important enzymes, including PSA, prostate-specific antigen, which helps liquefy semen after ejaculation so sperm can move freely. Together, with the help of your pelvic floor muscles contracting rhythmically, this cocktail is expelled with force. That's why every detail, the color, the volume, the pressure, even the sensation, tells a story about these systems. Message number 1 is a change in volume. One of the first signals men notice is a difference in how much semen they produce. You know your own body. You've seen enough to know what's typical for you. But if you notice a sudden drop in volume, or even a completely dry orgasm, it's time to pay attention. Often, the simplest explanation is dehydration. Remember, semen is mostly water. If you haven't been drinking enough fluids, your body may have less to work with. But sometimes, the cause goes deeper. For example, retrograde ejaculation. Instead of traveling outward, semen flows backward into the bladder. This can happen as a side effect of medications like alpha blockers, often used for prostate issues, or after certain surgeries such as TURP. It could also be caused by blockages. A duct can become obstructed, preventing fluid from mixing and exiting. Or it could be a hormonal imbalance. Low testosterone can reduce the activity of the glands that make semen. So what's the action plan? First, hydrate well. If the problem continues, especially if it came on suddenly, consult your urologist. A change in volume is not something to ignore. Quick question for you. Have you ever noticed changes in your own semen volume after a long, hot day when you were low on fluids? Drop your answer in the comments. I'd love to know how common this is among our viewers. Message number 2 is a change in color. Healthy semen is typically whitish gray, but sometimes the shade changes, and that can be alarming. A yellow tint is usually harmless. This can happen if a little urine mixes in, if you're taking certain vitamins, or if you've eaten foods high in sulfur like garlic or onions. A greenish tint is a possible sign of infection in your prostate or urethra. Bacteria can create discharge that mixes with semen, altering the color. And red, pink, or brown semen means there's blood in your ejaculate. This condition is called hematospermia. Now here's where age matters. For younger men under 40, hematospermia is often harmless, like a burst blood vessel, similar to a nosebleed. But for men over 50, it should always be evaluated by a doctor. While still often benign, it can also be linked to infection, severe inflammation, or in rare cases, cancer of the prostate or bladder. So your action plan? Don't worry about mild yellow. But if semen is green, or if you see any trace of red or brown, it's time to book an appointment with a urologist. Let me ask you this. If you notice blood in your semen, would you panic, or would you feel prepared to calmly get it checked out? Share your thoughts below, because your answer could help other viewers who face this same situation. Message number 3 is a change in force. Ejaculation isn't just about fluid, it's about muscle power. The semen is expelled through contractions of your pelvic floor. If you notice the force has weakened, if it feels more like a dribble than a strong release, there are two main suspects. The first is prostate enlargement, also known as BPH. As the prostate grows with age, it can squeeze the urethra, making it harder for semen to exit with power. This is a common symptom of BPH, alongside frequent urination. The second is pelvic floor weakening. Just like biceps or quads, your pelvic floor muscles weaken with age if they aren't exercised. This age-related muscle loss, called sarcopenia, can directly reduce ejaculatory strength. Here's the good news: you can do something about it. Pelvic floor exercises, also known as Kegels for men, are proven to strengthen these muscles, leading not only to stronger ejaculations, but also better bladder control and more satisfying orgasms. So if your ejaculation feels weaker than it used to, check with your doctor about your prostate, and start a daily routine of pelvic floor training. Have you ever tried pelvic floor exercises? If not, what's stopping you? Let me know in the comments. You might inspire someone else to get started. And before we move on, here's a friendly reminder. If you're finding value in this conversation, subscribe to The Healthy Body. That way, you'll never miss future guides on energy, circulation, hormones, and longevity. Message number 4 is pain during or after ejaculation. Now let's get serious. Ejaculation should never be painful. If you experience sharp pain, burning, or a dull ache during or after climax, your body is sounding a loud alarm. The most common culprit is chronic prostatitis, also called chronic pelvic pain syndrome. This is inflammation in the prostate, and the contractions during orgasm can trigger intense discomfort. Other possible causes include acute bacterial infections, blocked ducts, or other urological disorders. Here's the non-negotiable action plan. If you ever experience pain with ejaculation, see a urologist. Don't waste time searching for home remedies. This is not a signal to ignore. And I want to ask, if this has ever happened to you, did you see a doctor right away? Or did you wait it out? Your answer in the comments might encourage someone else to seek help sooner. Message number 5 is a change in sensation or pleasure. Some men notice their orgasms feel less intense, less satisfying, or simply different than they used to. This can point to several underlying issues. It can be hormonal. Testosterone drives libido and sexual intensity. Low levels can dull orgasmic pleasure. It can be neurological. Stress, depression, and poor sleep can blunt dopamine signaling, reducing how rewarding orgasm feels. It can be muscular. Weak pelvic floor contractions mean weaker orgasms. And it can be circulatory. Poor blood flow reduces sensitivity and overall function. The action plan? Take a big picture look at your health. Get a hormone panel, manage stress, improve sleep, eat clean, and move your body. Often, restoring these basics reignites the intensity of pleasure. Have you noticed differences in sensation as you've gotten older? What do you think caused it? Hormones, stress, or maybe circulation? Share your thoughts, because others may relate more than you realize. So let's wrap this up. A change in volume could mean dehydration, hormonal issues, or retrograde ejaculation. A change in color. Yellow is usually harmless, green suggests infection, and red or brown means see a doctor. A change in force points to prostate enlargement or weak pelvic floor muscles. Pain is a loud warning sign of inflammation or infection, and must never be ignored. And a change in sensation often points to hormones, stress, muscle strength, or circulation. So there you have it. A full guide to interpreting the signals your body sends through ejaculation. If you found this video valuable, please subscribe to The Healthy Body. Every week, I share science-backed strategies to help men and women improve their energy, vitality, and longevity. And if you're curious about what other signals your body might be sending, not just through semen, but through any changes down there, I recommend watching my upcoming video, A Man's Guide to Lumps and Bumps That Aren't Cancer. This has been Dr. Alex, and I'll see you in the next video.